right, Olivia. As I stated, my name is Dr. Perez. Thank you so much for coming into the clinic. So I was speaking with my nurse. She said she already went ahead and got the preliminary stuff done for you, so that's great. All of your vital signs and everything looked normal, so that's wonderful. I am going to go ahead and get started with your scalp exam today, if that's okay, given that's the reason for your visit. So we do have a pair of gloves here that I'm just going to pop on. Are there any specific concerns or any reason for your visit today?
None particular, no.
Okay. So just kind of an overall checkup, making sure there's nothing going on?
Yeah.
Perfect. So I appreciate you for keeping on top of your checkups. It is very important, especially given that we can't necessarily have a great look at our own scalp. So I'll just be making sure that there are no cause for concern today. So just go ahead and relax for me. It is going to be a fairly in-depth examination. I will be moving your hair around and having a look at your scalp in various areas. I have a variety of tools that I'll be using here, and I may ask you the odd question, but other than that, you're welcome to relax and whatever makes you comfortable, okay?
Okay, thank you.
If there are any areas of tenderness, please let me know.
Okay.
Okay?
Thank you.
All right. So just going to have a look at the state of your hair to begin with. So just looking at the hair itself, having a look at the hair shaft as well as the follicle and the end. So just going to basically look at the state of your hair, the overall health, any reason that I should be concerned today. So your hair as a whole does appear very healthy, so very well maintained. It is obviously clean, and I'm not seeing an overproduction of oil. So it also doesn't appear that your hair is very dry, so that's good. It is well nourished. So just having a look at the ends. Okay, so noting any breakage or any cause for concern there. So your hair is about medium to long length. Okay, so it does appear this is your natural hair color. Just both sides, so no indication that there's any breakage caused by artificial color. Okay. Good. Okay, so palm manipulation, there's not any sign of excess loss. I'm not getting any loose pieces that are coming out, so that's very good news. Okay, so just having a look at these shorter pieces here. Okay, so just have a look with my light. Okay, so just kind of loosely sectioning off a couple areas. Okay. Okay, so having a bit of a deeper look at your ends here. Okay. Good. Okay, so I'm going to start by sectioning off a couple of areas so that I can have a better look at your scalp. So I just have a comb here. I'm going to be using the end of my comb to section off various areas. just going to up this portion. Okay, so we're getting a closer look at the scalp. For any signs of abnormality, so looking for any signs of possible infestation or any eggs, which I'm not seeing. Also looking for any flaking or any indication of dandruff or excess dryness of the scalp. So I'm not seeing anything. I'm just going to slightly manipulate the scalp and see if I can produce any excess dead skin, which so far I'm not noting. Very good. Okay. The hair follicle itself appears to be well intact. Good. Okay. Just gonna comb a small section here, and I am seeing just one very small little flake of skin here, which is totally normal. So as with the rest of our skin, our scalp does shed its cells very regularly, so it's completely normal to see a small amount of what might look like dandruff, but it really is just dry skin that's coming off of the scalp, and that is completely normal. Just going in and having a look at a different section here. So it does look like you have a natural part. So I'm just going to make sure to look at this area specifically, looking for any signs of sun damage. So I do sometimes see with my patients that if they tend to part their hair in the same spot, there could be a sunburn or some excess discoloration or even possibly a mole that would be of concern. So I'm just going to have a look at this area to make sure that I'm not noting anything there. And again, all of that does look okay. Scalp is normal in color for age and ethnicity, which is good. Also taking special note of the hair that is in the part, simply because I do find that where the hair is parted repeatedly, sometimes there can be excess breakage there. So just having a look at that. So what I'm going to do now is do a little bit of a test of the integrity of the hair itself. So just relax for me. You're just going to feel some slight tugging of the scalp, and I'm just checking to see if there are any weaker areas, specifically of the crown. So I'm just going to very gently tug on the hair. Testing the ends of the hair, which tend to be more brittle due to the longevity. So the ends of our hair is the oldest portion of our hair, so I do just want to make sure that I'm not noting any excess breakage here or any elasticity. So over elasticity we typically see when the hair is wet, but I do just like to test for any gumminess of the hair strand itself, specifically at the end. And as I can tell, all of that looks okay. Alright, so what I'm going to do is use this secondary comb. This is going to allow me to compress the hair shaft so that I can see any smaller pieces that have detached. So I'm just going to do that in a couple of different areas here. So I am seeing some areas of new growth at the crown, which is good. And again, not noting any excess shedding. Okay. Just having a bit of a look at the hairline. Specifically looking at the temporal region. Okay, very good. And I'm just going to tug slightly. Shouldn't cause you any discomfort. Just testing the strength and integrity of the hair as well as the follicle. Little aerator device, and this is just going to allow me to produce a kind of concentrated puff of air on certain areas of your scalp. So the purpose of this is just to test for any dislodgement of any debris or any possible dandruff or seborrheic dermatitis that I may be missing. So I'm just going to blow the air at your scalp, and if there's anything notable, it should dislodge and come to the surface. So do this in a couple different areas. Good, okay. So not seeing anything there, which is a good indication that there are no signs of kind of malicious activity happening within the scalp. I do see one small area here, so let me section this off. So I see one very small patch of dandruff here. Nothing particularly notable. It does appear that you just have a very small area of dryness. Just making sure that it's not anything more concerning. I'm going to go ahead and move on to a test for neurological response here. So I'm going to touch your scalp in various areas with a couple different tools, and they all have a different tactile sensation. So the purpose of this examination is to ensure that there are no neurological impairments as it pertains to your scalp. So hypothetically, if something were to touch you, or if you were to injure yourself in some way, particularly a head injury, I do want to ensure that you are able to feel that sensation. So I'm just going to be touching you with a couple of different things. I would like you to indicate to me, if possible, when you feel it. So you don't have to identify what it is or where it is. I would like you to just tell me when you feel something, okay?
Okay.
So I'm going to start with something slightly more obvious. So again, you don't have to identify what it is, just say yes if and when you feel something.
Yes. Good. Yes. Yes.
Good.
Yes. 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 Yes.
Very good. Okay. Okay. So I'm going to do that with a different tool here, and the same thing.
Yes. 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 Yes.
Very good.
Yes.
Good. Okay. Alright. Okay, so I'm going to do a similar test this time along your hairline. I'd like you to indicate whether or not it feels any different on either side. So I'm going to test this bilaterally. So for example, if you can tell me if this here feels any different than this here, okay?
Okay.
So let's feel about the same.
They feel the same.
Feel the same.
The same. The same. The same.
Good. Okay. Can you feel this here?
I do.
Okay, good. Can you feel this here?
Yes.
Good. Okay. And this as well?
Yes.
Good. This as well?
Yes.
Good. Okay. Very good. Okay. So I'm just going to continue having a look at your scalp. You're welcome to just relax. This time I'm going to test for neurological reflex, and I don't need you to indicate whether or not you feel it. I'm just looking for a specific reaction, okay?
Okay.
So you're just going to feel a couple things touch your scalp, and just Go ahead and relax for me. Do let me know if any of this causes you any discomfort, okay? Very good. So just looking to see if there are any areas that respond abnormally. So far, getting a very healthy reaction. Good. Okay, so I'm going to test one last area here. Very good. Okay. All right. Just gonna tap around your hairline here. Alright, Olivia, I'm just going to perform some palpation. So this is just going to consist of me kind of feeling around your scalp. If there are any areas of tenderness, please let me know, okay? I'm going to go ahead and feel down and around your ears as well. Just behind the ear. Feeling for the bone structure and any abnormalities in the cranium. Up to the lower region. I'm going to make sure that there are no areas of tenderness here. Feeling along the hairline for any signs of abnormality. Good, okay. And I'm going to feel along the scalp itself. Feel some anxiety. Feeling for any abnormal lumps or bumps, anything that I might have missed below the surface of the skin. Good. So far, all of that does feel normal. I'm not feeling anything that is more prominent. I'm just going to feel kind of underneath here. Perfect, okay. go ahead and check for signs of temperature variation. So I just have a thermometer here, and I'm going to just test a few different areas. Make sure that there is nothing more concerning. So you're slightly warmer right at the crown, which is what we'd expect, so that's great. An area that was slightly warmer here. Any pain or discomfort here?
No.
That feels okay. All right. Okay, so I think the last thing I'm going to do here is just pull out an individual shim. We just want to see one singular hair strand here. Just following the strand from the root, looking for any signs of abnormality here. So far, nothing notable. Okay, so that all appears okay. Hair strand itself is circular and does taper down at the end. Looks like the widest portion is up at the root of the follicle, which is great. Okay. So the very last thing I'm going to do is just have a brief listen to a couple different portions of your scalp with my stethoscope. So this is going to feel just a little bit cold. Just want to listen to make sure that there is adequate blood flow throughout. So I'm going to start here at the temple. Good, okay. And then lastly, I do just want to place this behind the ear. Okay, so nothing of concern there either. Okay. Alright, Olivia. Good news is that we have completed your scalp examination, and I can't say that there is nothing I saw that was abnormal. So you did have one area, very, very small, about the size of a pea, that had a small patch of dead skin, completely normal. So as with any other part of our body, our scalp does shed occasionally. So we have dead skin cells that come off, and that's totally normal. So normally with regular exfoliation from your shampoo, or if you use like a scalp massager in the shower, that will take care of that adequately. So I didn't notice any areas of concern. There were no abnormal moles, no abnormal bumps or lumps underneath the surface of the skin. Your hair follicle is very strong at the root. I'm not seeing any signs of excess breakage or abnormal hair loss. Definitely no signs of alopecia. I didn't see any abnormal moles or discoloration of the skin or any cause for concern as far as sun damage or sun exposure. So that is great news. And your hair itself is very healthy. It does appear very, very well maintained. And so I don't think there's anything to be concerned about today. Just as a precautionary measure, I would like to see you back in a year. Of course, we do like to keep up with regular examinations, okay?
Okay, thank you.
So if anything were to happen between that time and you feel like you need to come back in for a checkup, you can go ahead and schedule and we'll get you in. But if not, I'll see you in about a year.
Okay, thank you so much.
All right, thank you so much, Olivia. I hope you get home safely. You have a good day, okay?
Thank you.